the last speaker of the session before the panel discussion is Tenna Andreasen, who's the chair of the European University Hospital Alliance, EUHA, steering committee, which leads strategic collaboration among Europe's largest university hospitals. She brings a system-level view on how hospital alliances can drive research, innovation, and clinical excellence together, as well as how EU policy frameworks can better support such collaboration.
Yeah. And whose is the next one?
And whose is the? I was going to say that. Yeah.
Yes.
Well, thank you. Thank you for having me. I haven't been here before, like Sys, but I've known Sys for many years, 10 years, and I've been deeply involved in biomedical design, so I think you should check it out. It's really a lovely program. But yeah, as you said, I'm the chair of the EUHA, or European University Hospital Alliance Steering Committee, and that is because Aarhus University Hospital has the chair now, and next it will be who's actually in like a month or so. And I have some good colleagues here, Elina and Marco and Anna and so on. And just, go to them if you want to know more also about whose participation in this. So I'll just briefly go over what EUHA is and then a bit about how we promote and support and enable innovation across. But I'll do it pretty quickly and then we can go to the questions. So the European University Hospital Alliance is pretty new, actually, it's 8 years old. It's founded in 2017, and for now it brings together 11 of the leading university hospitals in Europe. And HUS is the latest member, and before that, Aarhus University came in. As you can see, it's like King Health Partners, Erasmus, Val d'Hebron, Vienna. We have a lot of really strong university hospitals as part of the alliance. And here's some numbers, so you can get like, okay, what are we actually talking about? Nearly 300,000 employees, 20 million patient visits, 30,000 beds. So it's a big engine to cooperate with and in. So why this alliance? Why this University Hospital Alliance? University hospitals play an essential role in our society, in our healthcare system. They take care of the most complex systems. They do a lot of research, high-end research, and they pioneer healthcare and innovation. And probably some of you guys have worked with university hospitals in developing your product. And also, of course, there are huge importance in training the next generation of healthcare professionals. And what is EUHA then? Yeah, we are both high level and, as I think our term is, leading by doing. I'm new in that, but I know that. And I love that leading by doing, because sometimes it can also become so high end that we forget to, involve people on the ground. But EUHA is actually both a network of a lot of work groups and networks between clinicians within the hospitals, both in hospital management, in public affairs, in rare diseases, in digital health, all kinds of issues. We work closely together on, and also on innovation. So you can see here, we both work really practical on the ground, and also, of course, due to our size and what we're here for and the voice we represent, we do advocacy. We want to, and you guys, you talked a lot about it, AI Acts and the framework programs and so on. And what we try in the Alliance is to make position papers and make our voice heard within the different commissions, DGs, and so on. So that is actually also a very important thing of what we're doing. So here, just a brief overview of some of the focus areas we have. We have benchmarking, policy advising or advocacy, cancer care and management, which are important, rare diseases, because, in Europe, rare diseases, we are, like in Denmark, we're a small country, so the number of rare diseases or the patients are few, so how can we work better together with making better care, clinical trials in greater cohorts and so on. And then, of course, also responsible research and innovation. So our view upon the university hospitals is there are actually important innovation hubs. So how do we try to promote that, and how do we try to engage in building an infrastructure that you can tap into and make a more scalable innovation solution or a solution? We have an innovation network, and that is between us university hospitals, where we do position papers like where do we stand towards the EU program, what kind of elements do we want to promote funding on. Then we also share methods, knowledge sharing, how do we work with innovation in the hospitals, how can we promote innovation, how can we do it better, and so forth. And some of the things are also important, like clinical trials. I mean, how can we easier make cross-border clinical trials? That's also important talking about scaling. Also, and there's been talk a lot about AI, and I think I've been in this game for 20 years working with innovation, and I think the last 15 I heard about AI. So I'm really looking forward to getting even more implemented within the daily care. But we also try to optimize data use by building a pan-European observatory, and that is actually for patient-reported outcomes, which of course is also, you have the European health data, you have the patient records data, the clinical information, but of course more and more also we have the possibility to have patient-reported outcomes. Then we work with common data models. Omar, I think so. Omar, someone of you were also talking about that. How can we make these common data models so we can make much more broad-scale clinical trials and learn from each other, both to commercialize but also for the academic and clinical view. We push for simplification. There was also a talk about that. How can we use, the MDR, IVDR, how can we make it a bit more simple than we do today? Because of course, a lot of you are probably startups or small companies, and that's a bit of a jungle. But yeah, so let's try to do that more simple. Then we also try to promote, take our own medicine, because we talk about university hospitals as innovation hubs. But we also need to invest internally in innovations departments, position. What do we work with that on site? Also, so you companies have guys to work with on the ground. And then we're beginning to work with, hopefully soon, with common to establish common innovation indicators. I don't know how it is in Finland, if you have like national innovation indicators for health innovation, but we are working on that in Denmark. But maybe it could be a good idea that we made it a more common project. So that we've started working on, and I think we have already 11 countries to work from. So that could be a good idea. And then also we try to influence, as I said before, the different framework programs, the different funding mechanisms. And also we start influencing the FPT program, the Framework Program 10, which starts in 2028. And also to promote, I think there's been talk about this also earlier today, like data sandboxes, how to promote even more public-private cooperation. We do large horizon programs in EUHA, and we do it with industry also. So we try also to be not just talking about it, but actually also doing it. And then also, how could we perhaps align more the innovation task with the policy priorities? Because there's a lot of bottom-up innovation, and that is good. But we need more, perhaps faster implementation. We need perhaps also more funding to it. And if we align it with our policy priorities, that could also be an issue to think sometimes a bit more top-down. And then, of course, we do administrative burdens. So this is the things we do. And you can talk to Elena from HUS, or she sits up there if you want to hear more. Yeah.
All right, so thanks, Tenna, and